Finally, I'd like to invite Professor Yang to conclude today's symposium. Professor Yang, please.
Thank you very much. Today, we share the experience from patients and doctors. And probably you were surprised to see our patient who received total gastrectomy. They look quite nice. And regarding today's program, just let me summarize some of them. Early detection, that was a success in Korea and Japan. And right now, all over the world, general people, if you have some continuing epigastric or abdominal discomfort or pain, don't ignore it. That might be important. Don't ignore any symptom. And second, for the surgical, we have heard about the scientific evidence for the non-inferiority of laparoscopic surgery. So now it is common to see the laparoscopic surgery, but that does not mean open surgery is poor. Although there's some more complication, but still it is acceptable. And regarding robotic surgery, actually this is a kind of a form of laparoscopic surgery. Robot, which is a more articulating device, so we may have some benefit. So in Japan, Professor Terashima, he put a message that in Japan, robotic gastrectomy is covered by insurance because they showed some less complication, such as a pancreatic fistula. But in Korea, national insurance not yet accept because as professors today presented, not serious difference, although robotic surgery is more expensive, cost more. So we are still working on, and future, hopefully we may use more robot with under the scientific evidence. And you heard about today continuing effort to develop promising new drugs to improve survival. And the patient learned today the process of adoption of new technology. This is quite good phrase here from Professor Rosenthal. Evolution, but we need evaluation. So monitoring, and that might be the transparency of the process. And patient safety first. And in the last discussion, we emphasized the patient education, especially mutual communication for the decision or information. So we had actually a lot of questions on from our participants from all over the world, but we did not have time, so we will discuss with the Korean Cancer Association, with the DDF, how to answer these questions and how to share today's this content available to a general public. And lastly, I wish our gastric cancer patients still suffering or get a recurrence should have well recovery. And for the successful today's meeting, I already mentioned at the opening, but now I would like to mention especially Professor Im Soga of KCA, and also interpreters. You know, medical terminology is very difficult, but our interpreters have done a very good job. Thank you. And dot planner. And now DDF and the Korean Cancer Association will come back with the next virtual program for patients, hopefully in November, or next year, June, in Seoul, we will have Asian Oncology Society big Congress. And during that, our annual meeting, we will provide this kind of a virtual program with all the patients and the doctors, care providers join again to share our experience and also improve our gastric cancer patients. Thank you very much all your participation. Have a great day.